We are part of a U.S. lymphoma consortium in which we had several centers get together and get their data together on what are our practices on outpatient tisa-cel, outpatient axi-cel. And I think I just looked back at the data accumulated from these 8 to 9 centers. There were 6 centers that did outpatient in this cohort. We looked at, and our cohort actually captured axi-cel and tisa-cel patients. We did not have a huge number of axi-cel patients that got outpatient CAR T. So we just focused on tisa-cel. So we looked at baseline patient characteristics, LDH, labs, CRP, looked at disease burdens, comorbidity index, age, sex, all of that, and compared inpatient and outpatient. And we found that 2 significant factors which were different between the inpatient and the outpatient group is that the outpatient group had, the LDH the LDH being in the normal range. The proportion of patients that had a normal LDH was higher in the outpatient group, as well as the Charlson Comorbidity Index was lower, significantly lower in the outpatient group. So since it's a retrospective study, we can't look at the actual selection criteria or make those selection criteria, but this suggests that patients that have lower comorbidities and probably lower disease burden are probably appropriate and are going through tisa-cel, our plan for tisa-cel, are probably appropriate for an outpatient setting, especially if there is an infrastructure for an outpatient CAR T delivery. And I do think that access and delivery are increasingly important areas to address in research.